Guidelines and policies. All guidelines or standard operating procedures, processes and policies are available on the Trust intranet. Some care groups may have set national policies they are worked to, such as the neonatal unit. There will be a link on the Trust intranet to access these. The Trust aims to be NICE compliant with all guidelines and must declare if they are partially or non-compliant. This includes quality standards from NICE. All guidelines are written in line with current or best practice guidance. Information as to the most current best practice can be requested via the library services and should be detailed in the relevant guideline for further reading. A SOP provides the clinician with the process or procedure to follow within the Trust, for example, how to acquire blood for transfusion. A guideline aims to follow best practice relating to the subject area, for example, diabetes in pregnancy, and will also aim to be NICE compliant. However, other areas of best practice can form part of the guidance, such as the Royal College of Obstetricians and Gynaecology. A policy is set within the Trust and is written in tablets of stone. For example, the uniform policy, which details the correct attire a clinician or other health professional or employee is expected to adhere to. Deviation from any guidance requires a clear rationale and should not be undertaken without consultation from seniority. Documentation requirements. All clinicians should adhere to Trust and professional guidance and policies when documenting any care. All documentation should be clearly written in chronological order and contemporaneous. Any errors in documentation should be struck through and signed, still allowing those reading to see what has been deleted or overwritten. All documentation should have the person's name printed as to who is making the assessment, their designation, time and date, and any sketches to support findings if this assists the sharing of information. All documentation should have the patient's name, date of birth and individual identification number, such as the hospital number or NHS number. All documentation, paper, should be filed in chronological order. Do not use brand names for medication or prescriptions. Adherence to the Trust Medicines policy should always be undertaken. Any admissions or error relating to medication should also be clearly recorded as to the events. All EDS should be completed in a timely manner, and any referral letters to tertiary centres and GPs or other care professionals to evidence sharing of information and ongoing care. Regular documentation audits are undertaken through the whole Trust via the Perfect Ward app. Please ask your wards for outcome of local audits. Infection control and uniform. There are hand hygiene audits and PP audits which are undertaken monthly. The Trust adheres to bare below the elbows policy, no long sleeves, no wristwatches, bracelets or rings with stones. The dress policy for all staff working in clinical areas, no neckties, no false eyelashes or nails, scrubs are not acceptable, a uniform unless worn in specific areas such as theatres or maternity. Patient experience. All complaints and compliments are led by patient relations. All divisions and care groups are responsible for ensuring complaints are responded to in a timely manner and are monitored via quality and safety boards. Complaints can link with concises and or serious investigations to support a response to the patient and or the family who are raising the complaint. Patient relations also have a family liaison officer, affectionately known as FLO, who can support the family while an investigation is being undertaken. This is not for all families, as there is a criteria set in place. For example, FLO can support cases for coroners so that the family feel engaged in the process at a difficult time. There is also a Trust-wide quarterly magazine led by Patient Relations, Learning Matters. This aims to share with the Trust and public and patients the learning that the Trust has undertaken to improve patient care and safety within the organisation. Learning from excellence. What is learning from excellence? Its safety in healthcare has traditionally focused on avoiding harm by learning from error, which is patient safety 1. We believe that studying excellence in healthcare can create new opportunities for learning and improving resilience and staff morale. Patient safety 2. Learning from excellence has 3 stages. Stage 1 is for staff to make an excellence nomination using Safeguard via the Trust intranet using the Windows login. Stage 2, the letter of recognition will go to the staff members or team who are nominated to outline why they were nominated. Stage 3, the nominations go to the LFE steering group, who then decide whether a local investigation is to undertake or a full right analysis. What is information governance? Information governance, commonly known as IG, is a framework of standards for handling information in a confidential, secure and efficient manner in order to deliver the best possible care. It explains how we hold, obtain, record, use and share information. IG compliance means that the organisation is committed to implementing policies and procedures to ensure information is effectively managed. This includes sharing patient information with health organisations and business partners in a controlled manner and consistent with the interests of the patient. Every employee is responsible for maintaining information governance standards. Information governance is in use across every NHS organisation, and you must have a clear understanding of what is required. We need to encourage NH staff to follow best practice when accessing, using and sharing personal information to ensure its use is appropriate and legal, to ensure the Trust fulfils its legal obligations and responsibilities, to ensure teamwork and communication, to ensure proper sharing of patient data across organisational boundaries, to reassure patients to trust the NHS to use and protect patient records appropriately, to identify risks. Clinical audit and effectiveness. As a team, we provide support, guidance and advice around clinical audit, patient safety alerts, CAS central alert system, NICE guidance, medical guidance, admiration. We work with individuals and teams across the division in the compliance and assurance for all of the above. All local within the organisation audits must be registered with the QR code. This link will allow you to enter all the necessary information required for you to start. Charlie the audit hero always says, always register your audit projects. Be careful with your data. Remember information governance. Seek advice and support from clinical audit and effectiveness team. Contact the clinical audit team. Share your findings and improvement is the aim of the game. Keep your actions smart.